I was born in Vietnam, and then my family immigrated to the US in Dallas. So when I was 4 or 5 years old, I grew up in Texas. Since then, I went to college in Texas, and then I did my residency at Baylor, Dallas, and then my fellowship at LSU, New Orleans. When I was growing up, my parents were always like, be a doctor. But I was like, I think I'm gonna be an engineer or something else. And so in high school, we had a co-op program. I shadowed at a cancer center, and then that was how I got involved in medicine in the first place. Once I got to med school, I never thought I was gonna be an oncologist, but all my research ended up being in oncology. So it was just a serendipitous calling. And when I interact with oncology patients, I feel that I can make a difference, and the relationship that I can develop with my patients is special and just unlike any other specialty. So when a patient hears cancer, it's a very vulnerable time, and they're allowing me to step in that space and allowing me to help them through that journey. So my aim is really just to personalize their treatment based on what they see their goals are. I really want to know what are their goals, expectations, so that I can cater the treatment that's effective, but also to meet some of those goals and expectations. Well, outside of the hospital, I'm pretty much your average Joe. My wife and I wanted a place with a lot of outdoor activities. I like going outdoors, so my wife and I, we like to hike a lot, have a dog, a little corgi, that we like to get to the park. And when looking, this came to be the perfect place. We've been to Smokies a couple of times already. We've done a couple of those trails. We've already hiked Mount LeConte. That was a trek. The cancer care development has really it's sped up quite a bit in the last 10 years. It used to be just where you got cancer and you just go get chemo. But nowadays there's a lot of different targeted therapies actually. And so now they're less toxic, they're more tolerable, so patients do a lot better and they survive longer on these therapies. So it's very exciting. With all the current treatments we have now, is all based on clinical trials. When a patient enrolls in a clinical trial, they're helping future patients. The thing that excites me most is just like the personalized medicine that oncology is leading to. Every patient is a little different, even with the same cancer, so even their treatment can be personalized. We have a very comprehensive group of individuals helping to take care of the patients with our navigators and easy access to the physicians through the navigators. And so there's a lot of compassionate care in that and just a lot of communication. Multidisciplinary conferences, they bring value because you're directly talking to the other specialists, and it's in real time so that we don't have to delay one patient going to one doctor at a time, which could delay care by several weeks. But I think anytime I tell a patient that they're in remission, hey, you're cancer-free, now we just need to keep an eye on you, but we're done with treatment. That is very validating.